Hello, everybody. I see some familiar names and faces, but for those who do not know me, I'm Lilia, and my pronouns are she and hers. I welcome all of you from Australia. I'm not sure if anybody's from New Zealand today. And Dr. Simon will talk a little bit about some of the concerns that people have been having given the current global situation. And we'll also give you all time to ask your questions, okay? So if you prefer to remain anonymous, as I said, you don't need to speak. You can just write your questions down in the chat and raise your hand. There's an option in the chat to raise your hand, and then when it's time for us to open up mics, we can let you ask a question in audio. So Dr. Simon, thank you, and it's all yours.
Thank you, Lilia. Thank you, everyone. This is a webinar, a presentation that we have prepared specifically for our patients from Australia and New Zealand, and it's exclusively for our patients that have already a booking reservation for surgery with us for next year. So first, I would like to emphasize the importance the Australian patients have at Facial Team. We began a beautiful story with the Australian patients in 2012, 2013, when we did our first trip to Australia. And since then, it has been growing tremendously. Last year, we operated more than 30 patients from Australia, which is amazing when you think that patients can go all across the world to have their facial feminization surgery. So we thank you so much for your trust. But yeah, today we are living a special situation during this crazy year of the COVID 2020. So what I wanted to use this webinar today is to confirm, to give you a message of positivity about the current situation and what's going to happen in the next months. Because of course we understand you can be on a situation of anxiety, or you are eager to have your surgery. Some of you, I understand, have been postponed more than once, and I understand how frustrating that is. I'm sure you understand it's not our fault, but doesn't matter. Everyone is suffering from this situation. And I wanted to direct myself exclusively to you today to talk a bit about what's happening right now at Facial Team during this year and what is our expectations for next year, okay? Perfect. So first thing is that the pandemic started in January, but as a real pandemic around the world globally, causing lockdowns and blockage on airline traffics, this started in March. So we have been around 3 months without performing one surgery, nothing. Okay, so the country was blocked, Europe was blocked completely. We also decided to stop our surgeries for a matter of safety from the staff, because we were not prepared to work in any kind of protocol of a COVID situation. So we stopped for 3 months. But during those 3 months, we have been working a lot. Okay, our decision was in these situations, when you are surprised by a situation like this, you can always think, should I stay quiet and wait what happens, or should I do something that is active, something that can produce? And this is what was our choice. So we decided to dedicate those 2 to 3 months very, very strongly, in one hand, to organizing the life of our patient that had surgery booked, and the other hand, producing science, which has been a trademark from our team since the beginning. So I wanted to show you very quickly, the work that we have been done during this year, which has been the record year for us regarding publications. So let's say the year of COVID has been the most prolific regarding science for Facial Team. So I'm going to show you here the scientific production we did, which is very interesting. So in April 2020, we were able to publish on PRS, which is the Plastic Reconstructive Surgery. Lilia, can you confirm me that you will see the screen? Yes, good. So in April, we were able to publish a very important article on PRS that is called Facial Gender Confirmation Surgery, a protocol for diagnosis, surgical planning, and postoperative management. It's a very detailed article that talks about a protocol of any surgeon around the world. What protocol should this surgeon or team have to treat a patient undergoing a facial feminization surgery? It explains step by step, not the technique of the surgery, which we have done in other articles, but the whole needs from counseling to other surgeries, coming from hormone therapy, how to diagnose, which is the timeline, the sequence of surgery, and what about the long term and the immediate post-op. This is an article that took for us years to prepare, and it's a collaboration with the Johns Hopkins University, and it's all coming to improve not only our day-by-day at Facial Team, but also to improve day-by-day in other centers, and also to improve the guidelines from WPATH. Another very interesting work we did in collaboration with the University of Washington was a prospective quality of life outcomes after facial feminization surgery. Okay, this was a beautiful work that we did together with these other universities, where we measure the improvement on life quality in patients undergoing FFS. So in general, we got that pre-op from a score of out of 100, patients pre-op would say that they felt their face was feminine around 47.2. 2 weeks post-op was already around 75, and on average, 6 months after surgery was around 80.6. So this is a very important article because it justifies for many, not institute, but institutions like, for example, governments or even insurances, private insurances, the importance of FFS in the improvement of quality of life of our patients. We have also, let me do here something like this. We have also worked in two specific articles that were very nice. One is called International Facial Gender Symposium, where we describe what was the consensus, the main information that we gathered during our last symposium at Johns Hopkins on last year. We were able to take all that experience and put it on an article and published it as well. And recently we have also wrote a small article talking about masking, that's called Masking Gender, where normally I describe the situation of patients that have to wear a facial mask and how this can be can cause episodes of misgenderism, just because of the fact. Let me see 1 second here. Just because of the fact that we are looking at a patient with a mask, and we are showing much more when you're wearing a mask, the upper third of your face, and this shows the expression, this shows the orbital area, this shows the forehead, and this can have a masculinizing effect in patients that didn't have still a forehead surgery. So it was more was like a curiosity from patients that got in touch with us now during the pandemic, saying that wearing a mask was causing more episodes of misgenders. And one of our very important articles from this year that is still under review, but it's almost there, is the lower jaw. It is a very important article for us because it shows our experience in the last 10 years with lower jaw and chin surgery. This is a surgery that is not very, very well detailed in literature still up to today. And as you probably know, we have been working with a very different type of technology and planning, where the surgery is planned on 3D scans and with 3D print cutting guides for it. I'm going to show you what they are. We are also now working, we have an article presented also, everything prepared this year, that is under review, where we discuss the importance of virtual FFS, or the simulation we do on pictures of our patients to help them understand the possible results and also help us decide small things inside their treatments. This has an importance, and we have presented this to the IGIR. It's one of the journals, one of the important journals from the States. And then our last accepted article that was accepted 2 days ago on the Aesthetic Surgery Journal. It's a very important journal as well in surgery. It's an article that talks about eye tracking. This is an article where we have taken people with eye tracking devices, which are specific, like glasses, that you can see where are they looking at when they are analyzing pictures of patients. And we were able to identify where do people look on the face to identify gender. It was a very beautiful article because with this article, we can confirm how the forehead area, how the eye area is one of the most important areas for identification of facial gender. I'm going to show you here quickly. I have prepared. This is how we are doing right now a surgery at Facial Team on the jaw and chin. So as soon as you arrive in Spain, the ones that have the patients here present that have a jaw and chin surgery plan, you have a CT scan like this, a 3D scan, and then we will be able to make on the scan the design of the cut we want to do on your jaw or chin, depending on what is your case. This software helps us to make cuts that are symmetric, that are precise, that are far away from the nerves. I will show you how we can see the nerves. And the most important thing is that we can bring this information that we obtain in the software to the real surgery. Okay? We obtain this image of the area we want to remove, and this can be 3D printed into a cutting guide like this. Okay? The cutting guides are used in surgery. They look like this. These are cutting guides printed. They are acrylic cutting guides that we can use during the surgery. This is how you would see on the jaw placed. And then we are able to make our cuts just along the cutting guides in a very precise way. This is an example of a jaw and chin recontouring before and after using the cutting guides. We even now are working with a new software. It is something new that helps us also to measure the amount of bone removed on each case. So we are able now to measure this as well, and we are starting to prepare reports that we will give to each patient having surgery. So not only they will see visually on the scan what has been done on the jaw, but they will know also how many millimeters of bone have been removed on each area. Good. So let's talk a bit about the COVID safe protocol. Here we're coming now to a situation, let's say when we came around June, and in June, of course, things change. In June, we wanted to be able to receive patients. We were already having more circulation around the world, and we got 4 surgeries in June only, but July already came as a wave in normal rhythm, so more than 30 patients. And we have been having around 30 patients a month since July. So imagine that for this, Facial Team had to create a very, very strong COVID safe protocol, okay? What is a COVID safe protocol? A COVID safe protocol is nothing more than a series of measures, a series of rules that we have to follow so that our patients can come to Spain, have surgery, and leave without the risk of getting COVID, or at least with the most minimum possible risk. I encourage you to go to our YouTube channel. Lilia is going to share with you later the links with that, where you can watch testimonials of patients that came during the COVID situation and explain how was the protocol and how safe it was. So right now we have operated more than 100 patients. I think we are over 120 patients inside, so intra-pandemic. We have been monitoring more than 45 countries. We have performed more than 360 COVID tests, and we had 0 positives up to this moment from patients and staff. We have staff that had COVID in the beginning of the pandemic in March, but since June, when we started working, we didn't have any positive case inside the staff. Okay. We have even been able to do consultations in Marbella. Of course, most of our consultations became online, but even during the pandemic, 55 patients were able to travel to Marbella for their consultation. So the COVID protocol is very strict. It will explain patients how to travel safely, how is going to be the testing from the moment you leave your country to the moment you arrive, what are the general precautionary practices of hygiene that you need to have while you're in Spain. And we will, of course, be taking care of you the whole time while you are here with us. The other thing that we have developed, it's the official team, is the facial team official advisory. Okay, this is it's actually we call it like a special task force from the team that is every day constantly looking and monitoring the situation from the countries of the patients that have to come to us. As you imagine, Australia has been monitored constantly. Okay, so what is that we want to do? This is different from the protocol, from the COVID safe protocol. This is a situation where what we want is to understand when can the patients from each country come to Spain for surgery. Okay, so we have been studying all these countries. Australia has completely different rules than America, that has completely different rules than Canada, or or countries from Europe, or even China. Okay, so this is a very important step for us. We have been working with this advisory task force in the last 3 months, and it has working really nice. We have, I want to tell you that right now, Australian patients and New Zealand patients are the ones that are having most difficult to come to us, for sure. Okay, but there are always ways to try to come during, during this situation of the pandemic where we are in an acute crisis. Okay, our predictions, of course, are that in the next months you will have a strong change, positive change. As you can see, things are changing every week. We're now getting inside, let's say, the vaccine wave. So now we are starting to get the first vaccines that are being approved. There's going to be not only one, but as you can see on the news, many vaccines, which helps because, of course, the amount of vaccination needs to be enormous around the world. So we are predicting now that we are, let's say, almost sure that we are going to be able to operate all Australian patients in the first semester if everything goes well. In the meanwhile, if any patient has more hurry, needs to do the surgery sooner, and would like to try to come before, you just have to let us know, and we will help you with that. From our investigation in Australia, it's not impossible to come to Spain because Spain accepts patients from Australia. What is difficult for Australian patients is to have a justification to travel from Australia or New Zealand to Spain. We can provide documents confirming that it is a medical treatment. Then, of course, we are on the hands of the local authorities of Australia to decide if you are a candidate that is able to travel or not. But if you are not willing to wait so much, you need to have your surgery sooner and you want to give it a try, let us know, and we will help you to accelerate the process to see if you can come sooner. Otherwise, we are trying to monitor, as I told you, as soon as possible that we have a possibility of opening of the borders, and then we will start receiving you, and our Australian patients and New Zealand patients have a priority in the booking, okay, and in the surgery performance. We're planning now for beginning of 2021, our traditional workshop, which is an event where we bring top leaders in surgery, not only for feminization of the face, but also body and hormones. And unfortunately, we had to do it online this year, but it's going to be a beautiful experience. And we have amazing speakers, such as you can see here. We have Dr. Bowers, we have Dr. Monstray, Dr. Devin Kuhn from Johns Hopkins. We have Dr. Miroslav Djordjevic as well. So there are amazing people coming to this event, and it's going to be an online event. Again, Facial Team is trying to pursue a way where we can concentrate information, the top information that exists nowadays, to provide for our patients a better treatment. Okay, so I think I'm going to stop sharing screen so you can see us good. Yes, perfect. This was what I wanted to tell you. I want to tell you my final message for you before opening for questions. I would love to have questions from you, is that it's worth waiting. The ones of you that are booking with us and that have booked with us have done this for a reason. I know most of our patients, they are extremely good researchers, and you really take a good look online and you investigate and you talk to patients. So I know you chose us for a good reason. So I tell you, you have waited a long time now. I know I'm as frustrated as you are. We are all frustrated, but it's worth waiting. And think that Facial Team during this time has became better, became stronger, became more evidence-based, and more eager to perform your surgery. So we are here waiting for you, and we will do everything that we can to accelerate the process of you having the surgery. So thank you so much. I'm open 100% for you the whole time that you need to answer any question that you have.
Thank you, Dr. Simon. Again, if anybody wants to write any questions they have in down where the chat is, there's an option, questions and answers. So you can write in there, or you can write it in directly into the chat if you have any questions. So far, I don't see any in the questions area.
As always, I speak so much that that people don't have questions.
No, you explained everything so well. And I put the links in the chat of all of the things you were talking about, the COVID advisory, the COVID protocol, and about the travel tracker, the monitorization, and it's all in the chat. So we do have a question here. What can you say about other Australians who have made it to Spain during lockdown? How many border exemptions have been accepted or denied?
Yeah. Well, it's not easy because there are specific situations, as I told you, of patients that came to us during the crisis from Australia. I don't know, I don't remember right now how many, but I think it was not more than 2, right, Lilia? I think Australian patients coming to us during the crisis.
Yeah, I think just 2. In US patients, we've had 2 as well, or 3, and 1 we just got permitted their visa.
Yeah. The thing is that we have to, we are living such a different situation month to month that let's say that the embassies, the consulates, the authorities were much more, let's say, against any kind of authorization in the beginning because nobody understood anything. There was no protocols, everybody was scared. Now it's different. Now the authorities are already receiving many requests for medical treatment abroad. So it's a different moment, and it's worth trying if you are, let's say, as I told you, in a hurry. There are possibilities from, and our center for our task force, as I told you, will talk to you to understand what is your current situation and see what are the options for you. If it's through, if you have, what is your nationality? We have patients in Australia that because they have a European nationality, they have even more easy ways to come. So we need to understand each situation. Unfortunately, we cannot give a general rule for all the patients.
Okay, Eric also asked, what can you say about, and is there anything specific to their applications that may help them get accepted?
Yes, the specific things in general are given by us. So as I told you, it's important that we know every specific situation, and in every specific situation, according to your nationality, where are you traveling to, from which countries are you going inside when you come to Europe, we can provide most of this information. We have been providing this, so we have already templates of documents explaining the importance of the surgery. So it's not that you have to prepare this. We can prepare this for you. The only thing you need to do is present it yourself there in your country. But we are providing this to our patients, this material, okay?
Yes, our scientific advisor is on this, and we've created a volume of documentation to help people in different countries access visas in order to travel.
Yeah.
One other thing, Dr. Simon, Melanie's asking, getting home from Spain is the worry when they go back.
Yeah. This is the problem right now because Australia is not like, for example, in the UK or European countries, or even America, they are not requiring the quarantine time, but Australia is requiring the quarantine time. So this is also something problematic because we don't know if the patient, when it comes back, can be quarantined at home. If you can't be quarantined at home, it's fine because you're recovering from surgery. But we have to confirm if you're coming back, if they're going to tell you, no, your flight arrives in Sydney, so you have to quarantine in Sydney in a hotel or in an accommodation that they provide. So these are all the things that are complex. And I completely understand. Don't take me wrong. I don't want to force a situation when you come to surgery and then you have problems when you come back. The only way for me that it should come is when the whole plan is very well organized, that you know what's going to happen when you come and you know what's going to happen when you go back. Again, the problem is that each patient has a different situation, and we sometimes can find solutions that can help. With the American patients, for example, it has been like this. in the same country, completely different decisions from different embassies, from different areas. So some patients are luckier than others. And again, it's also the factor of the moment you are applying. I believe that the further we are in time, the easier is getting to apply and get authorizations. Okay.
Great. Are there any other questions? And you can raise your hand or just make a note in chat if you would like to give a message via audio. Just let me know. We have another question here, Dr. Simon from Sahar. You mentioned supporting documents for border exemptions. Do you provide supporting documents for health insurance companies, as they are usually dismissive of FFS in Australia?
Yes, we do this not only for Australia. We did this for Australia already many times, but we do this for patients from all around the world. We provide documents for the insurance according to their needs, so that patients can work with refunds from the insurance, or even with insurances that provide the surgery before. So they already approve your surgery and they are able to pay for your surgery with Facial Team. In general, right now, the normal routine is that patients provide documentation that we give, and they are able to require a refund from the insurance after surgery. But yes, we can provide documentation according to what they need, what they ask.
Thank you, Dr. Simon. And one person here has made note, it's very important. Keep in touch with your coordinator on a regular basis. That is fundamental, because as things change, like Dr. Simon said, we are updating everything. So just stay on top of your coordinator, and she will provide you with all the documentation that you need. And one more question. Assuming we get the exemption sorted, but flights are canceled at the last moment, what are our options? How short notice can we reschedule?
Well, right now we are having such a flexibility that is completely, let's say, outside the general routine from Facial Team. So we are 100% flexible. We will never get or stay with any kind of deposit or payment from you because you don't get here in the date. This is a different situation. We understand 100%. So don't worry at all. Okay, if it happens about flights or even change on the rules, because sometimes you can have an acceptance and then suddenly this acceptance falls down. There's no problem. Okay, we're not going to cause or have any problem with the date.
Absolutely. Any other questions? Is there anybody that wants to open their mic? Let me know. Any takers? Let us hear your voices, your Australian accents.
Yeah, we didn't hear your accents this year. As you know, we go every year to Australia. This is the first year after how many trips, Lydia? We did? It was 7?
5, I think. Yeah, 5.
I did 6.
You did 6. I did 5.
Yeah. So this would be our 7th trip to Australia, and it's like a routine for me. I already miss. How can I not go to Australia once a year? So this year we didn't go. I'm sure that we are going next year. Doesn't matter when, but we are going, even if it's in second semester.
Yeah, exactly. These dates. This week we would have been in Australia because it came up on my calendar. ACON in Sydney. Exactly. We have somebody who wants to talk, so I'm going to open her mic.
Okay.
Melanie. Let me just make sure here. A minute.
Yes.
I think we can hear you.
Yes, hello.
You can hear me? Hi. I was just wondering, is it still fine for my wife to travel with me to Spain? And does she have to go through the same protocols and everything as far as COVID's concerned?
It's a very good question. We are inside our documentation that we provide to patients coming to us. We have already a part of the documentation for people that is coming along. Okay, because of course, for any kind of surgery, no one can deny the patient to travel to bring someone from their family or someone to help. So we give also the information for the embassies, for the consulates, for the local authorities, for the patient, for the person coming with you. And of course, this person will have to go through the basic protocol of COVID protocol to get in the country. We will not need to have the person coming with you to have a specific test of COVID in the hospital. This is only for the patient, but only the basic ones that are necessary for the country. For example, right now in Spain, when you come in Spain, you need to have a negative PCR test, at least that's not more than 3 days before you arrive. This is something new. It was not like this 2 weeks ago. So it's changing every time. This is something that would be necessary for the patient and for the person coming with her. Okay, but inside Spain, they would follow just basic protocols, not the same as the patient.
Okay, so do we? Don't know what that makes.
I think her partner is there asking the question. Were you finished with your question, Melanie? Or did you have another?
No, I think I'm finished. I've lost my train of thought now.
Okay.
It's fine.
Anybody else like to have a question? Nobody else raised their hand. Just put it down in the chat.
Yeah, I would like to then, if we are almost finishing, one message I would like to give as well is that please don't forget that I asked to make this webinar to talk to all of you about the general situation, but it's not because you are booked that we cannot talk again individually. So you can ask for a Skype appointment for your patient coordinator. You can ask for a Skype with us, with the surgeons at any point, to review the treatment, to talk about small doubt you have about every area of the surgery, to have even questions about your trip, anything. We are completely open for Skypes for all the patients that are waiting for their surgery. And this is an individual talk that we can have with you. You just have to ask your patient coordinator, okay?
I think Melanie remembered what she wanted to ask. Melanie, okay. I've opened your mic again.
Thank you. I just wanted to say that my surgery is not until June next year. So would I have to have a COVID test prior to leaving Australia?
Well, Melanie, the problem is that I hope not, because the problem is that things are changing, as I told you, every week. Imagine a situation where during December is already a reality that we will have vaccines being given to people, okay? So we are going to have vaccines in many countries starting in December. Imagine what is going to be happening in February, March, April. So what we have been following in the International Association for Air Traffic, the IATA, that controls all the airlines. One of the things they are creating, it's like a health e-pass, okay? So it's like an app that you have on your phone for everyone that is traveling internationally, and it's an app that is updated with the vaccines that you take. So what I imagine is a situation after March where patients are going to be able to travel much more, or because they have a vaccine, or because the vaccine has been spread to many countries, so it's safer to go, okay? So I don't believe so. I don't believe that patients in June will be having a PCR test 3 days before, because the situation should be much more under control than now. But again, this is a bit of guessing. It's a bit of projection, but I believe that from March or April, second trimester next year, situation will be completely different.
Okay, thank you.
Perfect. There aren't any other questions in the Q&A section, and I don't see any other hands up here, Dr. Simon. So I would just like to let everybody know too that if they want to keep up to date with the latest news from Facial Team, we have a newsletter. It's only monthly. We're not going to inundate you with emails if you're not already signed up. Here's the link in the chat. And also for any of you who are on Facebook but are not already in our patient group there, it's a large group, both people who have already had surgery, people who are booked, and other people who are still considering. And a lot of information gets exchanged there, so it might be helpful. So I'm putting the link there too, in case you're on Facebook and would like to join. I'd be happy to have you there. And myself and Sarah O'Connell, one of our former patients who has her own show on YouTube and everything, we're moderators there. So it's a very practical and informative group to be in. We have all kinds of topics organized with conversations that have happened in the past. So it's a good resource. And I encourage you to join us there. So, Dr. Simon, do you have any final comments that you'd like to share before we go?
Nope, just thank you. Thank you so much for stopping your day and watching this. My goal, as I told you, was just to give more information and reassurance about Facial Team's current situation and about your future surgery. I strongly believe we will be able to do very safe surgery for you next year. In 2021 will be a good year for everyone. And again, if you need to talk to us individually, just ask your patient coordinator and we can Skype and we can discuss all the issues or talk about the surgery, whatever you want to discuss. Okay. Thank you so much. And I really hope you have a nice week.
Thank you, everybody, for attending. And again, remember to contact us if any questions arise in the future. As Dr. Simon said, we remain by your side. We appreciate you meeting us today. Bye-bye.
Bye-bye.